The Newsday continues here on One News Now. I'm Sean Yao. Calabarzon has the second most number of COVID-19 cases outside of Metro Manila. Let's check in on Batangas City with Health Officer Dr. Rose Ozaeta, who joins us over the phone. Good afternoon, Dr. Rose. First off, can you tell us the situation on the ground in Batangas?
Yes, good afternoon. Okay, so yesterday, April 29, we have total cases of 11,367, of which we have active cases of 4,385. So technically, if we are looking at the cases, comparing the cases from 2020, so for the 2020, we have a total of 11,746. So kung titingnan po natin, wala pa po tayo sa middle of the year, so almost nag-equal na po yung cases natin from last year of 1 year and this year of basically like 4 months tayo. Yes po.
Right, Doc. So you're in a unique position po, no, to observe kung ano ba nangyayari dyan at bakit tumataas nga yung number ng mga kaso. Have you zoomed in or pinpointed the reasons why there's an increase in the cases there in Batangas? Or ano ba yung mga factors na nagko-contribute sa pagtaas ng mga kaso?
Well, like in other provinces din po, pare-pareho ito yung ating mga situation, ano? So, yung practice of the minimum health standards, kung minsan medyo nakakalimutan ng ating mga kababayan. Although, sa baba naman po yung ating mga LGUs, may mga ordinances sila for implementation. But, kasi ang Batangas, kakaiba lang po kasi ito, gateway po talaga ito, no? So, meron yung entrances tayo from Mindoro, from Romblon, no? So, meron tayong by sea. So, pumapasok din sa Batangas. So, for all we know, hindi natin alam kung magka-pass through lang sila or stay Batangas. Also, from Cavite, we have also entrances there, and then Quezon. So, lahat po ng mga pumupunta in and out ng Mimaropa or dumadaan po sa Batangas. So, at the same time, highly industrialized din po ang Batangas. So, marami din po dito talaga yung mga hindi na from Batangas. So, mahirap din ang monitoring yan. Although ang ating mga LGUs talagang very vigilant naman po sila pagdating naman po sa contact tracing natin.
Yes, so syempre porous talaga yung mga borders, especially nga dinadaan-daanan at maraming mga industries and factories in Batangas. When it comes naman to data on hospital utilization rate, Doc, kamusta ang mga ospital o ang sitwasyon ng mga ospital dyan sa Batangas? Nakakatulong ba itong bagong nating or ang current nating extended MECQ status?
Actually, in a way siguro, hindi din masyado kasi talagang let's say kahit na siguro dagdagan natin ang ating mga hospital beds, talagang madami talagang cases. So sinasabi nga natin hindi lang naman sa Batangas, but then in case of our hospital beds talagang very critical, nasa critical level yung ating mga, especially in terms of ating mga ICU beds. So even our public hospitals, so kasi we have about 16 isolation beds for our 12 district hospitals, kahit sabihin natin level 1 lang po ang district hospitals po natin, but for today, nag-cater na rin sila even mga pang-moderate na cases na kasi no choice, wala na pong mapuntahan mga patients natin. Once admitted sila na mild symptoms lang, kasi mild symptoms, definitely for level 1 lang sila. But pagka nag-progress na yung symptoms nila, naging moderate na, the problem now, wala naman po tayo paglipatan na level 2 hospital kasi even the level 2 hospitals, punuan na rin po sila. That's why nangyayari, minamanage na rin sila accordingly dito ating mga pasyente. So, right now kasi meron kaming mga dialogue with the private hospitals and the medical societies kung paano kami magtutulungan sa ganitong cases po namin. So, nag-start na po kami, even with the governor, yung ating sa Interagency Task Force and the Health Board. Nakasama na po natin dito ang ating PMA, mga private hospital associations. So, nag-uusap-usap kami kung ano ba yung magandang magiging partnership namin para at least yung referral or management of the patients is magkakatulungan po kami. So, yun po yung nangyayari po ngayon. So, definitely, both government and private hospitals po sama-sama po kami ngayon.
Alright, that's very good to hear, Dr. Rose. Now, may bali-balita rin na yung Monte Maria Shrine, no, will be converted into an isolation center. Can you give us more details on this and why you need another isolation center? Is Batangas as a whole rushing to build more centers or sites because of the recent surge po?
Yes, actually, di ba last year pa meron naman department, ng circular from the DILG that every LGU should identify and create isolation facilities in each LGU. So niya lang, in some LGUs talaga, kulang naman ng manpower. So actually, we have other isolation facilities, kanya lang siguro medyo kulang pa rin. Sa tingin natin kulang pa rin kasi if you have sorry, we don't have the data now, but based on our data, marami po kasi naka-under home quarantine, which is, ito kasi nakikita natin, pag naka-home quarantine, syempre kumisan yung mga pasyente, hindi mo na monitor yung kanilang activities. Unlike pag nasa isolation, at least nandun lang talaga sila sa isolation room. So, yes, the governor po instructed na talagang volunteer niya yung Monte Maria to be converted into isolation facility. So actually last week, nagpunta na po ang Department of Health, Regional Health Office to see the area. So natutuwa sila kasi I don't know if you have already visited the area, so it's very conducive. Spiritually and siguro mentally talagang gagaling ang pasyente doon. And then next week, pupunta ulit ang licensing team to see yung possibility yung talagang ano pa yung pwede natin gawin. So initially po, we intend to put up, I think, 150 beds lang muna. But kung talagang dadami, pwede tayo mag-expand. Although hindi po yung Monte Maria, actually nag-start na rin po tayo sa may sports complex. Meron tayong kinonvert doon na 2 floors for isolation din. So actually, meron na po ongoing na po yan. And last month nga, nag-rent na rin po kami ng hotel kasi karamihan din natin for our government employees na tinamaan din ng COVID, including their dependents, mga families po nila. So yes, Monte Maria po, nasa planning stage po tayo and approved naman po ito ni Gov. So nag-start na po tayo, actually mga beds, na engineering, gumagawa na rin po sila. So may mga plano rin po kung paano magiging set up po doon.
Yes, very nice indeed dyan sa may Monte Maria Shrine. Napakaganda pa ng tanawin. Now, in terms naman of COVID-19 vaccination of your healthcare workers there in Batangas, kamusta naman po, have all of them, for the most part, been vaccinated already, pati po yung mga barangay healthcare workers?
Actually, nauna lang po na-vaccinate po natin yung ating mga frontline at yung mga nasa hospital, mga RHUs, So, alam naman na po natin kakulangan po ng vaccines from the national. But ngayon po, nasa almost done na po tayo doon sa ating mga A1, although may mga na-delayed lang. Kasi for all you know, marami po tayong mga health personnel na nagkaroon na tinamaan ng COVID. So that's why medyo madidelay-delay lang po sila. But maano na po tayo, hindi ko alam yung percentage pero almost naman po lahat ng ating. Pero yung ating mga barangay health workers po, hindi pa rin po lahat. Kasi nga po, again, although kahit na gusto pa rin po nila, wala pa pong kulang pa rin po yung vaccines na dumating po sa amin. Itong huling batch, itong second batch po kasi hindi pa rin lahat ma-accommodate. So, we will just waiting for the next batch to be arriving po siguro by May. Sabi darating na po yun.
All right. So, in terms of healthcare workers in hospitals, almost all complete. Yung barangay health workers na lang. Noted on that, Doc. Apart from vaccine doses, any other assistance that Batangas needs from the national government?
Actually, very supportive naman po ang national government. So, not only for vaccines, but even logistics, And even health personnel, they are also assisting us in terms of mga doctors natin, mga nurses natin sa isolation facilities. Actually, in Batangas, ng governor po nagkaroon ng construction ng isolation facility sa ating mga hospitals. So, yun po, na-augment po tayo ng mga nurses, doctors po doon to man the isolation facility. So, again, sabi ko nga, hindi lang po mga mild ang accommodate natin ngayon, so even the moderate na dapat pang level 2 na-accommodate na rin po natin. So, very supportive naman po ang ating national government. Although, siguro, sinasabi may kulang pa rin, but still, nandun na rin po yung talagang malaki na rin ang tulong po ng national.
All right, thank you so much for your time and for entertaining all our questions. That was Dr. Rose Ozaeta, City Health Officer of Batangas. And a group of pharmacists has condemned the distribution of anti-parasitic drug ivermectin as a possible treatment for COVID-19. In a statement, the Philippine Pharmacists Association strongly opposed what it describes as the irrational dispensing of an unregistered drug recently. The group said that prescription medicines should only be compounded and dispensed by FDA-registered establishments. The PPHA also emphasized the importance of a valid prescription, as well as ensuring that patients are well informed about the risks and benefits associated with taking the medicine. Earlier today, 2 Metro Manila mayors urged their constituents to listen to medical experts on the use of ivermectin. Pasig City Mayor Vico Soto warned the public against subscribing to conspiracy theories.
Just because there is a little bit of positive news or a little bit of possibility or may nakitang konting scientific basis, hindi yun sapat para sabihin na okay na yan, pwede na yan. Hindi tayo mga doktor, hindi tayo medical expert, makinig tayo sa kanila.
For his part, Taguig City Mayor Lino Cayetano said that local authorities have yet to receive guidance from the FDA and the Health Department on the matter.
We listen to the medical experts. So pag dumating ho ang panahon na inaprubahan yan ng FDA, pag inaprubahan ho yan ng Department of Health, pag narinig ko sa bibig ng ating mahal na Yusek, sa ating Secretary of Health, by all means, no, we will not just support it, we will advocate it, we will buy it.
The Health Department reported 8,700 new COVID-19 cases on Friday. And this has brought the total caseload to more than 1,037,000, almost 74,000 of which are still considered active. 89 more deaths were confirmed today, bringing the total fatalities to over 17,000. On the flip side, recoveries are now at 946,000 after 4,100 new survivors were recorded in the last 24 hours. Meanwhile, the global caseload has breached the 150 million mark based on data from Johns Hopkins University, while the global total death toll is almost at 3.2 million. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.